Good afternoon, dear audience. We have arrived to the last item of the civilization diseases. Namely, this is the liquid bread, so this is a liquid food, namely the alcohol consumption. This is a very, very difficult topic, and I simply introduce the history and the social relations of this topic, and after that we will concentrate on the medical part of the problem. The alcohol consumption and the alcohol-related harm is a major public health issue in the European Union and all over the world. Alcohol use is responsible for approximately 250 up to 290 deaths each year across EU countries, according to the WHO statistics 2019. High alcohol consumption is associated with increased risk of heart disease and stroke, see previously, liver cirrhosis, certain cancers, and fetal alcohol disorders, premature deliveries. But even moderate alcohol consumption increases the long-term risk of developing such diseases. Alcohol also contributes to morbidity and mortality through accidents and injuries, violence, homicides, and suicides. The history of the alcohol consumption is long enough. Even in the mythology you can find some, only two exemplars. AEGIS is a Nordic god who prepared every time beer when expected the visit of another god. And Dionysos in Greek and Bacchus in the Latin, in the Roman mythology, used to be the god of the wine and the grape, and once a year they organized a fantastic feast with drinking and music and dance, and this was regular in the antique world. But returning to the today's world, we have to mention before finishing the history that the first brewery has been found in the Middle East approximately 15,000 years ago. Here you can see the picture, a consumption per person picture, per capita older than 15 years old in liter of pure alcohol. This is a 3-year average of WHO 2021, and you can see that the deep blue are around 20 liter, and it is decreasing to the very pale blue, which is only 0 or no data. So it is really a world problem, and the question arrives that why people are drinking. And you have to mention first the anxiolytic character of the alcohol, which was very nice described by Franz Hals, the merry drinker. But at the same time you can see a picture, a ash tray picture, about the consequence of the drinking at the next day, the hangover. To finish the general symptoms, I give you a summarizing picture about the effect of the blood alcohol level. It is given in percentage, but it's better to see in thousand. In thousand, because this is the official value. The official value 0.8 thousandths up to it is dry and decent, and this is only a subclinical, but you cannot drive even. Little bit higher, delighted and devilish, but arrived also the dizzy and delirious confusion phase, and later on dazed and dejected with stupor, and finally dead drunk or coma with more than 3 to 5,000 in the blood. So this is really a big problem, but this was only the acute symptoms, but you have this summarizing picture about the chronic, long-lasting effect of the drinking on the whole body, from the mouth, throat and voice box, mental health and addiction, on the brain and nervous system, lungs, breast, heart and circulation, liver, stomach and esophagus, blood and immune system, intestines and pancreas, skin and fat, bone and muscles, and even the sex organs are deteriorated by the long-lasting effect of the regular alcohol intake. Here you can see the gastrointestinal damage. The alcohol causes irritation and inflammation, which can lead to ulcers and cancer of the intestine, and especially of the colon, the later cancer. Alcohol may impair small intestine's ability to process nutrients and vitamins, to absorb them, and may cause secondary deficiency syndromes beside these ulcers. But we have to concentrate first on the effect of alcohol on the liver, which is the central organ in the metabolism. This is the primary site of alcohol metabolism, the liver. Long-term heavy alcohol use cause illnesses and deaths. The liver injury may be caused by direct toxicity of metabolic byproduct of alcohol, and also by the inflammation induced by the same byproducts. The liver has many essential functions, and therefore it's highly dangerous is the problem with the liver, because the liver is important in removing potentially toxic byproducts and certain medications and drugs. The liver will metabolize or break down nutrients from food to produce energy. Please remember to the glucolysis, lysis, and the gluconeogenesis. Help our body in fighting infections by removing bacteria from the blood. The liver produces most of the substances that regulate blood clotting factors. The liver may prevent shortages of nutrients by storing vitamins, microminerals, trace elements, and starch, animal starch, which is the glycogen. Liver produces most of the proteins of the blood, and finally may produce bile, a compound needed to digest fat, make the emulsion, and to absorb fat-soluble vitamins. The metabolism of the alcohol is related to enzymes, the most important being the alcohol dehydrogenase ADH, which converts alcohol to acetaldehyde through oxidation. Aldehyde dehydrogenase rapidly oxidizes acetaldehyde to acetate since the aldehyde are highly toxic, even more toxic than the alcohol itself. Catalase and microsomal enzyme oxidizing system, the previously called MEOS, multi-oxidation system, cytochrome P450 or SYP2E1 is an alternative pathway for alcohol metabolism in the liver. It produces acetaldehyde from alcohol. We have to mention that this enzyme activity is inducible, so in heavy drinker the activity is higher. Sign of liver damage of the damage of the hepatocytes and leakage and release of cell hepatocytes enzyme can show the liver damage. Maybe the most powerful is in this the gamma-glutyl transferase activity. Here you can see a summarizing figure of the previously described functions, the drinking alcohol, step 2 acetaldehyde, and step 2 harmless acetate. Not totally harmless because it's acidic, but less harmless. And acetaldehyde, extremely toxic, causes hangover. Here you can see a previously used drug, the disulfiram, which stopped the activity of the acetaldehyde dehydrogenase and make the acetaldehyde to accumulate, and in this case it was a conditioning for patient to get free of alcoholism. And you see that the NODH is the nicotine acid adenine dinucleotide which participate in this reaction. At the same time, the ethanol, the active substance of the alcoholic beverage, has a direct effect on the mouth, esophagus, stomach, and intestinal mucous membrane, included the immunological part, the gut-associated lymphoid tissue, and neural elements. The neurons are also damaged, which may be more important than the acute symptoms. The byproducts are dangerous, as the first mentioned acetaldehyde, but also free radicals are produced. A total reductive state of the metabolism may occur because the niacin acid dinucleotide phosphate hydrogen ratio to oxidized form will increase. More H form can be present, and this in its turn may cause a B1, a thiamine deficiency, which is also a participant in neurodegeneration. Liver has the ability to regenerate itself, but it is limited. The threshold dose of alcohol for a life is 600 kilogram ethyl alcohol taken chronically over 20 years, and after the liver cannot regenerate itself. This is equivalent approximately to 1 liter of daily wine intake. So be careful. And the first stage of the problem is the pre-cirrhotic stadium of the liver, a fatty liver practically, and the last phase is the cirrhotic liver, which can be seen in an endoscopic picture. We have above, based on this knowledge, the following types of alcohol-induced liver damages. We have fatty liver. At that stage, it is reversible. We have the alcoholic hepatitis with inflammation and destruction of liver tissue. Scar tissue may begin to replace healthy liver tissue. This is a fibrosis. The symptoms may have fever, jaundice, and abdominal pain. And the final is the alcoholic cirrhosis with extensive fibrosis that stiffens blood vessels and distorts the internal structure of the liver. Here you can see visualized the stages of the liver damages from fatty liver through the fibrosis and the cirrhosis, when even the connective tissue even may destroy the hepatocytes. The susceptibility may be influenced by heredity, genetic background, by the sex, because the liver is a different organ in males and females. The sexual dimorphism, the liver function is high, and the co-occurring liver illnesses may influence. Here is the pathological pictures of this terrible cirrhotic and fatty human livers. The possible mechanisms participating in the alcohol-induced liver damage are not only the ethanol itself, but the free radicals, because the lipids peroxidation caused by the free radicals will destroy the cell membrane integrity. Can be induced when alcohol is administered together with high-fat diet. High-fat diet and alcohol intake caused by the free radicals lipid peroxidation. The mentioned reductive state in the cells, the reduced niacin amide nucleotide phosphate and the ratio to oxidized version, hypoxia in the cells, and inflammatory agents like the harmful eicosanoids thromboxane B2 and leukotriene B4 may aggravate the situation. We have different risk factors for liver diseases besides the drinking. The genetic variation in metabolizing enzymes, the sex dimorphism, because women develop cirrhosis at a much lower cumulative dose of alcohol than the man. For the Y, we can mention the sexual dimorphism of the liver enzyme expressions and activity, and also the so-called load of the liver by the metabolism of the sexual steroids in the women cycle. The diet and nutrition, and this is the second. The first that we have a discussion about that is that the alcohol intake is related many times with the feeding, but also that the diet has an influence on the manifestation of the symptoms. The high-fat diet is a predisposing factor for fatty liver, and the thiamine deficiency can be improved by the feeding. Deficiencies such as the deficiency of glutathione, this is a sulfur-containing peptide, or the deficiency of vitamin A or E can decrease the liver's protection against the free radicals. The glutathione synthesis can be enhanced by methionine intake. Simply eat more egg and drink milk. Alcohol consumption promotes absorption of iron and facilitates storage of iron in the liver. And iron is an important catalyst of free radical production, so be careful. Based on these data, medical data, the World Health Organization set the maximum daily values, which, according to the knowledge of those days, were absolutely harmless. And this is for females 20 gram ethyl alcohol and males 40 gram ethyl alcohol per day, and which is equivalent to the males' dosages, maybe 1 liter of light beer, 0.4 liter of wine, light, table wine, 1/3 liter of champagne, and you see that 0.64 liter of heavy spirit, 40% of alcohol, a whiskey. Female values 50% of the above values. So it is not a high amount, but many people cannot consider even. If you have a liver disease, we have some possibilities for the treatment. The alcoholic hepatitis can be treated by corticosteroids and by silymarin intake. You can take by your food more antioxidants like vitamin A and E, and you have to increase your thiamine intake. Antibiotics and immune system inhibitors sometimes are useful to prevent the collagen accumulation. If there is alcoholic cirrhosis, only some polyunsaturated lecithin can be given, and the last chance is the transplantation. But we cannot stop at the WHO limit numbers, because there was a huge trial, a comparison of more than 100,000 people from different part of the world, and many possible diseases, consequences has been statistically evaluated. And here you can see the relative risk for mortality graph. Standard drinks daily. One drink is approximately what is proposed or allowed by the WHO. And you see that even at the one standard drink, you have some relative risk. Relative risk means that the risk for a death is higher and higher and higher, or the other approach, the lifespan is shorter and shorter. And I summarized this study. This was published in the Lancet 2018, alcohol use of burden for 195 countries and territories between 1990 and 2016, a systematic analysis for the global burden of disease, study 2016, and the conclusions are the following: that the alcohol use is a leading risk factor for global disease burden and causes substantial health loss. And we, the alcohol collaborators, that's 100 scientists, we found that the risk of all-cause mortality and of cancers specifically rises with increasing levels of consumption, and this is what we have to emphasize and underline, that the level of consumption that minimizes health loss is zero. We have to emphasize, because it was also found by medicals, that a moderate red wine intake, for example, may help in some atherosclerotic problems and heart problems. Yes, it is true, but not true, for example, for the development of cancer. In this case, the zero intake is the best. Finishing my today's lecture by the 3 no's. The first nose would be the over drinking. Even the binge drinking is dangerous. The second no, the weed, and the third no is the smoking. Maybe against obesity would be good, according to Van Gogh, skulls and skeleton, but I don't think so. Thank you very much for your precious attention.